Saharan dust does not just affect the view, it can also affect your health. Our Alexis Green joins us live once again in studios with how to stay safe when this dust moves into the coastal bend. Alexis, good morning.
Good morning, John Thomas. We've talked about Saharan dust and here on First Edition and who it can affect. But let's focus on those most vulnerable. Joining me this morning is Dr. V from Corpus Christi Medical Center. How are you, doctor?
Yeah, I'm good. Thanks for asking.
Yeah, let's touch base on those who are most comparable to this Saharan dust.
So again, as I said, that even someone does not have pre-existing lung conditions, but if the lungs are more prone to as I would say hyper-reactive, then they can develop some symptoms. But more so if they have pre-existing conditions like asthma, if they have been smoking, and if they have chronic obstructive pulmonary disease like COPD. If they have certain conditions like where their airways, just dilate, like bronchiectasis, then obviously when you have some pre-existing lung conditions and then you inhale some stuff, obviously it's going to be not good, and it might affect them more than others. But again, as I said, that everyone needs to be careful, even if they don't have pre-existing lung conditions. It doesn't mean that they're not going to develop one by inhaling the small particles.
So, it's summertime, a lot more people are out enjoying the sun and all the outdoors. What is something we can do to kind of help prevent this?
So whenever, check the AQI, like, whenever the air quality index is bad, obviously, I won't say not to go out because getting sunlight is also important. And, people staying in home, is not good. Like, people can get depressed, and that's also an important thing. But at least when they go out, probably use the right mask so that they don't inhale that particle size, or probably use some air filtering systems that are effective. But most importantly, if they develop some symptoms, then they should seek medical advice or get evaluated, because what happens is sometimes they might have some pre-existing condition, but it was never symptomatic. But when they inhale these particles, then they develop symptoms, but it's not just from inhaling those. Maybe they have COPD from smoking or some exposures in the past. Maybe they have asthma that was not diagnosed. So again, whenever they develop symptoms, they can seek medical attention. And obviously, we have some great experts at Corpus Christi Medical Center who can help them. I think we have some great pulmonologists who are trained at some of the best places in the world. And so I think, what my suggestion would be that, not to delay seeking medical advice whenever people develop symptoms.
That's great advice. Thank you, doctor. We really appreciate you joining us here on First Edition. People, are definitely talking about some of that Saharan dust. We had Kellyanne touch on it a little bit earlier. We're going to have this full story on our website at KIIITV.com. Back to you.
Alexis, thank you so very much. We appreciate